Okay, welcome back to Pain Talks here at Pain Consultants of East Tennessee. My name's Dr. Ted Jones and I'm a psychologist, and today I'd like to answer a question about addiction and opiate medications. We have a number of patients who come and state worries about opiate medication. I'm scared about being placed on that medication. I've heard it's addictive. I don't want to have anything to do with it. I don't want to become a drug addict. And so the question is, what is that relationship between opiate medication, prescribed opiate medication, and addiction? Physical dependence is very common with opiate medication. It's also common with steroids, it's common with antidepressants, it's common with a number of medications. And what that means is if you take it regularly for a period of time, if you stop, you'll have a physical reaction, withdrawal. And opiate withdrawal, you can have a mild case or a moderate case depending on your dose of medication. Physical dependence is not the same thing as addiction. And so we want to avoid physical dependence if we can. But it often happens with opiate medication. And like I say, that's not an indication that someone is a drug addict at that point. Drug addiction is having a problem with the substance, opiate medication. You misuse it, you take too much, you run out early, you get it from other people, you have a problem with it, and that's addiction. And so a number of people on prescribed opiate medication will have physical dependence, but they won't have addiction. The rate of addiction to prescribed opiates is about 10%, 10 to 15% in the general population are the number of people that are an addict to one substance or another. And so there's maybe a 10 to 15% chance of addiction for somebody prescribed opiate medication. There are risk factors for people that might become addicted. There's personal histories and family histories of substance abuse, and those often predict what folks may become addicted to their pain medication. So basically the answer is yes, some people might be at higher risk for becoming an addict or having a drug addiction to their prescribed opiate medication. We at Pain Consultants do a careful assessment on people before we prescribe opiate medication to see if they're one of those people that might be at higher risk, and then we work hard, even harder, to use alternative methods and not prescribe opiates and not cause that kind of addiction. But most people, about 85 to 90% of people, do not become addicted to their prescribed opiate medication. They're prescribed opiates either short-term or long-term, and they don't become a drug addict. So there is a chance of addiction. It's really pretty low. Careful screening and assessment is a key to be sure that somebody doesn't become drug addicted to their opiate medication.